Welcome to the American Association of Critical Care Nurses Voices in Nursing podcast, exploring critical care nursing through meaningful and inspiring conversations. This episode is sponsored by AACN's online course, Fundamental Skills for Preceptors, with information available at www.aacn.org/preceptor skills. Now, here are your hosts, AACN's Chief Clinical Officer, Dr. Vicki Good, and Clinical Practice Specialist, Andrea Schmidt.
Welcome to the Voices in Nursing podcast. This is Dr. Vicki Good, AACN's Chief Clinical Officer, and I am joined by Andrea Schmidt, a Clinical Practice Specialist at AACN.
Hi, welcome to the podcast.
Today we're tackling a very tough issue, but very important topic, which is bullying and incivility in the workplace. It's something that many nurses experience, but often don't talk about openly.
That's true, Vicki. I feel like nurses who get exposed to this sometimes keep it inside, and it really can have an impact on their mental health. And I think in general, these behaviors, impact not only the mental health, but patient safety and team dynamics. So why does this happen and what can we do about it? So we're going to break it down today and talk about strategies to create a culture of respect.
Yeah, and I think all of us at one point in time have felt dismissed, undermined, or even targeted at work, and we're not alone, but oftentimes we don't like to talk about it. So if you've ever felt that way, this episode's really for you. But before we dive in and get started, I want to introduce our guest. She's a friend and a colleague of mine. I've known Renee for quite a while. So our guest is Dr. Renee Thompson. She's the Chief Executive Officer and the founder of the Healthy Workforce Institute. Welcome, Renee.
Thanks, Vicki. I'm really happy to be here and engage in a conversation about, as you both said, a very important topic that not everybody is openly sharing and discussing and talking about. So really happy that I have this platform to have this important conversation with you.
Well, Renee, we're very happy to have you. And before we get started on the bullying portion, can you share a little bit about your nursing journey and what led you to this topic?
I'd be happy to. So I've been a nurse for more than 32 years, and I always say that I've done everything that you can do as a nurse. Bedside, I worked for a home care agency, I worked for a managed care company, I was a nurse manager, nurse educator, and had a corporate position at when I was finishing up my working for a company period or season. And it was when I was working in this corporate role and I was responsible for professional development for about 10,000 nurses. So that was nurse residency programs, preceptor programs, student programs. So anything related to the student experience or the new nurse experience fell under sort of my umbrella. I did a lot of focus groups, had a lot of conversations with nurses, and you know what? All they wanted to talk about was how poorly the other nurses treated them. And it reminded me of my own experiences when I was a new nurse, when I was a new educator, when I was a new manager. It didn't matter. And I realized that it didn't matter what organization I worked for or what role I had. I swear there was always a group of people who made it their mission to make my life difficult. And I thought, working in healthcare is hard enough without worrying about your coworkers making it harder. And we've been talking about bullying and incivility for a century, but what are we doing about it? And it was a moment. I just, in that moment, decided enough was enough. I was going to do something about it. And I quit my really good job that I actually loved to start my own company with an intent to do something to eradicate bullying and incivility in healthcare. And now 15 years later, here I am doing something about it.
That's awesome. And I know you and I have had many, many conversations over the last several years about your work in the Healthy Workforce Institute and our work on healthy work environments and how those two bodies of work really do intersect. So what led you to your interest in combating, workplace bullying and incivility to create this Healthy Workforce Institute? You kind of talked about it, but what light bulb went off to say, oh, I need to start a whole movement?
Well, to your point, Vicky, I have been a huge supporter and fan of the healthy workforce environment, the framework that you're using at AACN. And what I thought, though, there was a missing piece, not only in your framework, but a lot of other frameworks, and that was the people piece. It was there, but not focused in a way that was very actionable dealing with the workforce. So I remember when I started this company, I just started it as a speaker. I just wanted to get on stage and talk about bullying and incivility and give people strategies. And people wanted more. So then I started doing workshops. Okay, people wanted more. 2-day seminars, people wanted more. So I launched an online academy. And then I had an organization reach out. It was actually someone in HR who said, "We really like your practical strategies. We'd like to hire you as a consultant to help us implement those strategies." And honestly, my first thought was, consultant? I have no idea what that means. You know what we do as nurses. We figure it out. And I did. And that actually is where I spend probably right now the majority of my time is working with leaders and organizations to implement. And what we decided to do was it's a system. We have a framework that there's such synergy, Vicki, between the framework at AACN focusing on the environment and our framework focusing on the people. You can't have one without the other. And so I thought that was a really nice complement, and it is really helping us to work with organizations to not only eradicate disruptive behaviors and cultivate a healthy work culture, but sustain that work too.
I think this is great that you're tackling this very important topic. I think, even though it's out there, it's still huge. I see it all over Instagram and Facebook. I see reels of nurses, they'll be crying because of some deem, you know, the Mean Girls Club sometimes of feeling like they're getting picked on because they're not perfect or they're not behaving a certain way. And it really takes a toll on their mental health. And I don't know that in general, nurses really understand that that nurse's mental health then has an impact on patient safety. Can you share a bit of the data that is regarding this impact of bullying and even incivility?
How much time do you have?
I know it's a huge topic.
It is. And I always say, like, don't take my word for it. I mean, I have numerous data points and conversations that I've had with, nurses at every single level on the negative impact bullying and incivility have on fill in the blank. But I'll just name a few. And these are a few that really let us realize that addressing workplace bullying and incivility isn't a nice to do, it's a need to do because of the impact that it has on our patients. So there was a safety and healthy practitioner study that showed when someone is dealing with someone at work who is either bullying them or is being treated very poorly, by this person, 48% of those people decrease their work effort, 80% lost time worrying about working with that person, and 66% said their performance declined. If your mom, your dad, your spouse, your partner, your child is a patient in your department, would that be okay with you? I don't want your performance to decline when you're taking care of my mom. And that's just one study. I know AONL and the Joslin Insight study that came out in April of 2025 showed that the number one factor impacting psychological safety, which, is in direct alignment with patient outcomes, number one factor is incivility. So it's not even just bullying, it's incivility too. And there's always a direct correlation between the level of bullying and incivility that is ignored or, just not being addressed and patient outcomes, even from our medical colleagues. So there was a study that came out in JAMA a couple of years ago that showed when a surgeon is rude, okay, rude to the people that the surgeon is working with, orthopedic surgeons in particular, they have a 10% higher infection rate. So we can't just say we're evidence-based and then cherry pick which evidence we're going to support.
Mhm.
The numerous studies show the negative impact disruptive behaviors have on the very patients we've been, we're supposed to be serving. And when you look at it from that perspective, people realize, yeah, this isn't a nice to have soft skills. This is essential that we address this.
Can I have you circle back for a minute in case some of our listeners don't know really what incivility means and how it's different than bullying? Can you explain that, please?
I would be happy to, because this is one of the reasons that bullying and incivility continue, especially in healthcare, is because of confusion regarding what it is and what it's not. Because people tend to call all bad behavior bullying, and it's not. And then, when we look at true bullying, the way you handle true bullying versus incivility is different. So we can see sometimes why these behaviors continue. But for a behavior to be considered bullying, there has to be three things. There has to be a target. So let's say, Vicky, there's just something about you. You're my coworker, something about you that I don't like. You're this brand new nurse coming in who thinks she knows all that. And so what am I going to do? I'm going to target you. I'm going to pick on you. I'm going to give you the worst assignments. I'm fine with everybody else, but it's just you. So there has to be a target. It could be one person or a small group of people. I work the night shift and I don't like any of you day shift nurses, day shift. I target the night shift, or I'm an experienced nurse. I target the new nurses, but there has to be a target. The behavior has to be harmful in some way. If I refuse to give you a report, if I withhold information, if you're new and you're just off of orientation and I deliberately give you the worst assignments, setting you up to fail, who is that potentially harmful to? Sure, the person, but it's also putting patients at risk. So there's harm. And then it can't be one time I get testy with you in a crisis situation when I'm under stress, because we can all misbehave when we're under a lot of stress. What we're looking for is a repeated pattern of behavior. So to be considered bullying, there has to be a target, it has to be harmful, it has to be repeated over time. The good news is we do a lot of what I call deep dives in organizations. We kind of go in, we pull back the covers, we lift up the gown, and we look to see what's happening. We actually don't see a lot of bullying. I mean, it's there, but it's not as prevalent as everybody thinks. What we do see is an awful lot of incivility. And those are those low level, rude, inconsiderate. I help the people that I like. I don't help the people that I don't like. It's the eye rolling, the gossip, the mocking. If you've ever heard somebody say, I feel like I'm in, middle school again, that's usually incivility. Everybody can remember that one person from high school or middle school that was truly a bully. But most of what we see is just this, I don't know, emotionally immature, behaviors. And that's more prevalent. Now, good news, bad news. If you can actually show that somebody's bullying, target, harmful, repeated, that's easy to address. You have policies about that. What's not so easy is incivility, because incivility is culture. And I always say, your culture didn't get this way overnight. It's not going to change overnight. It can change, but it takes more effort to change culture.
Well, and Renee, let's talk a little bit about your approach, because there's lots of different recommendations from researchers out there on how to address bullying and incivility. But what makes your approach unique? And I know you just released a new framework, and so I just would like to explore a little bit about that.
I would say, Vicki, there are two things that make our approach different. So if I look at the framework, and again, we've been implementing this framework for years, but we've never articulated it in a framework. So now, yay, it's finally in a framework. So I'm excited about that. It all started really when I was doing some consulting work, and the chief medical officer, when I was explaining what we do, he's like, oh, so this is a top down, bottom up, and everything in between approach. And I thought, oh my gosh, that's so simple and brilliant. And so our framework, we have three pillars. You have to strengthen the organization, that's the top. You have to equip your leaders because they are the number one, okay? They are responsible for the culture in their department. But it can't just be the leaders and the executives. You have to empower your team. So that's that third piece. So that's what makes our approach different. It makes it sticky because it's not just putting all the burden on one role, one person. Okay. It is the entire organization. And this is not a nursing issue. We all know that. But sometimes we talk about it as if it is a nursing issue. This is a human issue. So our framework involves the entire interprofessional team. So it's physicians, providers, support staff, respiratory, pharmacy. I always say if you have humans working in your organization, you have the potential for disruption. So that's one way that it's different. It really is, top down, bottom up, and everything in between approach. The second thing, and probably what I'm most known for, is our practical, simple, easy to implement strategies. And I'll give you a perfect example of this. I had an executive leader reach out to me, and here was the story. She said they were losing a lot of employees, and they did a survey and they found that it was due to bullying. So the chief executive officer, the CEO, brought everybody together, all the leaders together, and basically said, enough is enough. You have to start holding people accountable for their behavior. Now go do that. 2 years later, they reached out to me for help. That's what I find people do. You have to start confronting. You have to start holding your people accountable. Well, guess what? If you don't teach them how to do that, they're not going to. So what we do is we actually get very granular. Say these words to this person when they're doing this. How do you address someone's disruptive behavior when you don't witness it? A lot of managers, a lot of leaders don't think they can have that conversation. I teach them how to have that conversation, when to have that conversation, who to have that conversation with. So it takes things from sort of a higher level, holding people accountable, confronting disruptive behaviors, setting behavioral expectations. And we take it down to that, granular level and give them the scripting and all the tools that they need to be able to do that. And it works. I just had a coffee chat this morning with a group of leaders that I did a workshop for. We call them coffee chats. Like we get together a couple of weeks after I do some type of workshop. And then we talk about, all right, what did you learn? What did you implement? What are your challenges? And, we all bring coffee or tea or water. And we engage in a conversation and we talk about the stickiness of these strategies. And what I love to hear are people who say, I heard you say this script 2 years ago. I wrote it on an index card and I still use it. So that to me is reinforcement that sure, we need to, set that expectation that the leaders are holding people accountable, but we also need to then teach them how.
I love that.
I agree 100% with everything you're saying. I've been a nurse just about the same amount of time as you, and I've seen it throughout my entire career at multiple organizations. It's happened to me. I, became a target just for having a locker above somebody else's. And, she was just standing behind me, like waiting for me. And from then on, I feel like I had a bullseye on my back, silly stuff. Like you do feel like you're in grade school. And, I feel bad. I have a special place in my heart for people who go through that because I've been the product of that myself. But I think what's so challenging, and this is some of the stuff that I'm seeing out there on Instagram, is nurses who say, what is the point of me even going to my leader because nothing ever changes? They're always afraid, oh, but she or he is such a good nurse. We don't want to lose them. But in fact, they're losing the good people because they can't stand to come to work. And, they don't know how to manage the person who is doing the act or, being, whether it's bullying or being in civil. And I think what's sad is that we don't look at the nurse as a whole. We think skill only. Oh, she or he is a great nurse. We can't lose them. But how good of a nurse are you, really, if you can't be a nice person and you're bringing down the entire department, right? And it's like, how do we get the staff to get comfortable to go to their leader, no matter how many times they have to do it, to force something to change. Because I think this is where some of the hang up is there because they don't see results. They just stop going and they stay quiet about it. So how do we make that change? How do we encourage nurses to go out there and talk to somebody? And if the manager doesn't listen, where do they go next?
Yeah. Great question. I will try to answer this in a very succinct way because
I know it's huge.
my happy place, okay? This conversation. It starts with the leader. And I know that leaders in general are conflict averse. People don't like to confront other people for lots of different reasons, you know. And when we look at human beings, there's a psychological reality that exists in all of us, and that is we avoid pain, part of our survival. If I'm a 24-year-old new manager and I have a 61-year-old clinically competent nurse the physicians love who's been there for decades, excellent clinically, but is disruptive, and I just had someone in my office crying, a brand new nurse who's quitting now because of this nurse. You want me to say something to her? People will do what's comfortable. They will do nothing. And so without giving them the strategies and the support, so this is an HR conversation. So it's go to HR, go to your boss, say, okay, this is the third time. This is what's happening. I need to have a conversation. Do I have your support? And, what does that look like? So it does start with the leader, but it can't just be the leader. Something that we work with leaders to sort of start changing people's mindsets. Classic. Employee goes to the manager tattling on a coworker. And either they'll tell the manager, like they'll say to the manager, okay, this is what happened, the manager, because this happened to me. Can you write that down? I'm not writing anything down. Okay, you know what? I'll go and have a conversation with them. No, 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 don't say anything. Because if they find out it was me, they're going to make my life miserable. Okay, so there's that situation. But then other times they want the manager to do something about it. And if the manager doesn't come back and say, hey, I put this person on corrective action, they're on a final warning. The staff, they assume the manager's not doing anything about it. And I know when I was a manager, that's what happened to me. My staff were sitting around complaining about the fact that I don't hold anyone accountable, like I said I would. They didn't know there were two of my employees. All I needed was one more thing, and I could have terminated them. But I couldn't walk around saying, all I need is one more thing. Like all I need is one more thing because it's confidential.
Right.
There's that piece of it too. And we work with leaders on strategies to, kind of mitigate that. But I do want to share one more strategy. We need to get this from the leader's burden to address to everyone's sort of burden. So peer-to-peer feedback, okay, instead of just tattling to the boss. A way to start doing that is when an employee comes to the manager and complains about a coworker. It's the scripting, it's the language. The manager could say, well, have you shared this with them? And they say no, because chances are they'll say no. Just ask this one question. If the situation were reversed, would you want this person coming to me complaining or going to you directly? So it's changing the conversations because truly the default should be peer-to-peer. So Andrea, if you and I are working together and you cut me off or you argue with me or whatever disruption it is, the default should be that later on that shift or the next day I say, hey, Andrea, can we talk about something? I'm not sure you realize this, but you really dismissed me in front of everyone yesterday and I was embarrassed, okay? And, I don't even think you realize you did that. So it should be peer-to-peer as a default. Now, if you and I keep going at it, then we go to the boss to say, look, we've tried to work this out. It's not happening. We need your help. But that's not what's happening right now. Everybody goes to the boss to fix their problems. But then they put limitations on the boss on, oh, don't say anything. I just want you to know. I'm like, I don't just want you to know. Yeah. It's complicated. It's human behavior, but it is solvable.
And it's hard too if the person's afraid of the other person. It's like you don't really want to confront them, right? It's scary, but
Yeah, you're
it's
right.
all great advice.
You bring up a really good point. I am not a martyr. I totally understand. There are some people who I worked with that if you paid me $1,000 to confront them, I would not. Okay. You have to pick the hills you're going to die on. Okay. Like there are some other ways that you can protect yourself from those people. I always say when you're developing these skills of confronting, start small. Start with people you already have a good relationship with before you don't tackle the king bully in the department. You start small until you
Yeah.
build up that skill.
So, like even with workplace violence, we often talk about like, okay, here's some strategies you can do to potentially prevent that from happening. Are there any potential strategies that a nurse could take to prevent being a target of bullying?
Yeah, there are a few. It's interesting. Some we'll just call them bullies, although I don't like to label people bullies. It's their behavior that's, considered
Right.
bullying. But we'll just say, some bullies, they try to find someone who appears to be weak that they can dominate.
Mm.
And in that case, especially if you're new, I recommend walking in being a little assertive. So even body language, head held high, walking with your shoulders back. I am a huge advocate when you meet someone, you're meeting the other, your colleagues, shake their hand, really nice to meet you, eye contact. So showing your assertiveness. And then there's another part of that is also, you know, saying this to an experienced nurse. Wait a minute, you've been a nurse here for how long? 35 years? Wow. I bet there are some things that you could teach me that I didn't learn in school. Will you help me? Oh, when you ask someone to help you, they will take you under their wing and it'll decrease let's just say, your vulnerability of being a target. If you go into it with, look, I acknowledge your experience, I honor it. Being a great nurse isn't just what you learn in school, it's beyond that. So that has helped. But the other thing is, don't like if somebody's treating you in a way that's rude, disrespectful, um, don't just say, well, it's part of the job. Well, that's just the
Mm.
way nurses are. Nurses eat their young. I would just start in the simplest way and where we always recommend people begin is just name the behavior. You just rolled your eyes at me. You just interrupted me. You just huffed and puffed, and walked away from me when I, gave you a report. It's always easier to start with overt behavior, a behavior that you can actually name. Now, think about this. I'm not criticizing you, getting into an argument with you, lecturing you, counseling, coaching. I'm just naming your behavior. You just rolled your eyes at me. Just that. Just doing something like naming the behavior can also decrease your uh, vulnerability in becoming a target. Just simple things. And okay, let's just say no matter what, you are the target. Tell someone. Sometimes, we recommend tell your preceptor unless your preceptor is the problem. Tell your boss unless your boss is the problem. Tell an educator. Educators are usually a safe person to talk to because you don't report to them, but they have a vested interest in your success. So they can also be a good person for you to talk to. But that's the key is don't suffer in silence. Talk to someone.
It's sad that we even have to talk about this, but it's all great information. And I think so many people can benefit from this. And I know that you have tools and resources on your website. I think some of them are free to download, if I understand correctly. Can you tell us a little bit about them and then who should use them? Is it geared towards staff or leaders, etc.?
Thank you for asking. On our website, we have a resource section and there's a ton of things. So we do webinars every quarter. I have a blog. I've been writing a blog for almost 15 years. We have a YouTube video series called Coffee and Conversations about nurse bullying. That YouTube series is really geared for the front line. So someone who's taking care of patients, who's dealing with peer-to-peer bullying and instability. I have my own podcast that's really geared towards leaders. People can find that on my resource page. And we have a whole section of free downloads. So everything that's on our free download page obviously is free. I would say the majority are for leaders, but we do have some for the bedside nurse. For example, our power scripts. So again, Andrea, you and I are working together and you're really curt with me and you dismiss me. Well, we have scripts that all you have to do is read through the common situations and pick a script that you can practice. So the next time you're curt with me, I can say something in return. Not to zing somebody back, but just to kind of raise awareness and basically say, not okay the way you're talking to me right now.
That
So,
all sounds great. And I should have backed up and asked you, what is the name of your website?
it's healthyworkforceinstitute.com. So I'm going back to our framework. It's workforce. So it's healthy workforce because it's all about the people. Healthyworkforceinstitute.com.
Thank you.
So, Renee, as we start to draw this to a close, if you were to have one wish for this work, what would that outcome look like to you?
Can I give you two?
Sure.
Okay. I would love to get to a point where when we say this phrase to new nurses, they have no idea what we're talking about, and that is nurses eat their young. Well, you know how it is. Nurses eat their young. Instead, I want to see nurses support, grow, love the new nurses because my whole career before I started my own company really focused on the new nurse. So I would love to abolish that phrase, nurses eat their young. The second is really what my vision is. Every single day when I do this work, this is the vision that I have, and that is to create a world where bullying and incivility are immediately rejected and kindness, respect, and professionalism become the new norm. So that's the outcome that I'd like to see. Anybody acts out in a way that's disrespectful, someone is standing there. It doesn't matter who it is, like timeout. We don't do that here. Like we're going to reject that behavior. That's not how we treat each other. So that's my vision.
Well, and Renee, I just appreciate that similar to us with our healthy work environment standards, we consider it mission work. And a lot of the work that you do with your Healthy Workforce Institute, you consider it mission work, and you do make so many different resources available to the community. So I just want to say thank you for doing that. I also want to make sure that our listeners know that your latest book, which is called Enough, Eradicate Bullying and Incivility in Healthcare, we actually offer it in our AACN bookstore. So if any of our listeners are interested, I'm sure you can get it on Amazon, but we'd love for you to come to our bookstore on aacn.org and scroll down to the bottom of the website, and you'll see a Shop Now button, and look for that book in our bookstore. So I just finished up reading it recently, and it's very well done. So great work, Renee.
Thank you.
Well, again, this has been extremely informative, and I'm sure it's going to give our listeners lots of ideas and ways that they can enhance their unit culture, their behavior, their teammates' behavior. So I just appreciate you spending time with us today.
Well, thank you for inviting me and for being willing to have this conversation because we have important work to do in healthcare and we have zero time to deal with, bullying and incivility. So it's been a great honor and I've been such an admirer of all the work that you do at the AACN. So I appreciate you.
Well, thank
Thank
you.
you.
And I can say thank you again to you as well for allowing me to be a guest on your podcast. So it's nice that we're able to feature each other's work on our different platforms.
See that nurses should support each other, help each other.
Exactly.
Okay? Yes, this is we are being the role models for the way it really should be. And so yes, you were a great guest on the show, and we talked a lot about the healthy work environment framework. And like I said, it's such a pivotal piece of work that is withstanding the test of time. And didn't you just update it recently?
We're in the process right now.
Okay.
Yeah.
I know we talked about that. So
yeah, we're working on the 3rd edition this year. So we're excited about that. So
that's amazing. You seriously, something for me to aspire to get to the point where I have a 3rd edition of it. So yes, you're the role models for sure.
well, thank you. And I want to thank all of our listeners for joining us for today's episode. As always, we welcome feedback on this episode and ideas for future episodes. Please send us your feedback to podcast@aacn.org.
Thank you for listening to the American Association of Critical Care Nurses Voices in Nursing podcast, proudly sponsored by AACN's online course, Fundamental Skills for Preceptors, with information available at www.aacn.org/preceptor skills.